You're on.
Good evening, everybody. This is Dr. Gigi from the Rodham Institute here at the GW School of Medicine and Health Sciences. We are dedicated to improving health equity in Washington, D.C. I hope that everybody has had a safe and healthy summer and that your families are doing well. Before I introduce our special guest this evening, I just wanted to give you a quick update about what's happening with COVID. There's a lot of misinformation and disinformation out there, but I'm giving you the information that is the most up to date as of today, Tuesday, September the 21st, 2021. One of the things that I want people to think about when they're looking at reading any article or looking at the news or listening to the radio or looking at social media is the following. Think about COVID like a hurricane. Hurricanes, people try to do their best to predict their path and what level of devastation they're going to wreak, in terms of havoc, but we don't know exactly. So you'll hear when somebody's reporting on the news, Hurricane COVID, for example, this is a developing story. Stay tuned for updates. I want you to think about COVID in that way so that when you hear information that gets updated in the future, it's not contradictory information. It is that we have learned more, that the hurricane perhaps has changed its path, or that we've learned something about its behavior to update you. So just like any news story, stay tuned for updates. That's number one. Number two, the vaccine, despite what you're hearing in the news by some people and not news, but social media. Social media has been a huge source of misinformation. You can still get an infection, but you won't die or end up in the hospital if you get vaccinated. The chances of having that happen are extremely unlikely. So let's talk a little bit about the Delta variant. The Delta variant came about because as people who were not getting vaccinated or not using their masks or not washing hands or not creating physical distancing, the virus had a chance to infect people and turn each person that it infects literally into a COVID manufacturing plant. And every time that happens, the virus has a chance to morph and change and get more destructive, more deadly. What's different about this the Delta variant? Well, the Delta variant is much, much more infectious. When you look at just the regular old COVID, if I weren't wearing my mask and I had COVID, in 5 days, I could infect 2 to 3 people. With the Delta variant, if I had the Delta variant, I can infect 6 to 7 people in that 5 days. So you can see the multiplier effect. The other thing is, and this I want you to listen closely to because it has to do with children. Children, thankfully, are not significantly impacted by COVID in that the number of deaths, or the percent rather of deaths, is relatively low. However, and this is the big however, because of how infectious the Delta variant is, the absolute number of people, including children, is going up. And who leads the death rate when it comes to children dying of COVID? And we don't understand quite why. It's Black and Latino boys. So it's boys, children. So if you want to protect your children, especially the ones under 12 who cannot get vaccinated quite yet, and we now know that the ages between 5 and 12, hopefully the vaccine will be available for them in the next couple of months, you must get yourself vaccinated, or at least the adults that have any contact with the kids, because it is us, the adults, that pass the COVID on to kids. Kids really don't pass it to us. Kids really don't pass it to each other. We're the ones. So you might be vaccinated, the teachers might be vaccinated, but if your children are taking any bus to get to school or have any after school program with somebody taking care of them and the person is not vaccinated, they can pass the COVID to them. Finally, again, the number of people who are dying disproportionately come from Black and Brown communities. That's not changed. That's still the case. And in the states where there are the highest vaccination rates, the number of hospitalizations and deaths go down. In the states where that's not true, where the mask mandates, masks, people are not wearing them, guess what? It's going up. Finally, I want to talk a little bit about what's out there in terms of social media, because it is bad. There's a 15-minute video that actually the former First Lady of Washington, D.C., Cora Berry, shared with me. Let me tell you, it was so slickly produced. It was an animated video. It had so many people of color in the video. And it was all disinformation that was created by right-wing Fox types. And I'm like, wow. So then I said, well, why would right-wing people want to target Black and Brown communities? What is it for them? What is in it for them? Well, I mean, if you remember at the beginning of the COVID pandemic, what did the former administration say? One, people who are affected are above the age of 70. And if you're above 70, you've had a good life, move over. Second, the second group was people with pre-existing conditions. Well, kind of like it's your fault if you have any, particular condition, whether it's cancer or diabetes or lupus or sickle cell, that's on you. The third thing that they didn't say, which I believe was a form of passive genocide, is that 1/3 of the people dying are from Black and Brown communities. So when we talk about conspiracies, let's think about what kind of a conspiracy it is. All right, that is my discussion for today. Oh, and then people have been asking me about a third dose. I don't want you to think about it as a booster, but rather for those of you who have gotten hepatitis vaccines, remember you get one at time 0, second one at 2 months, and the third one at 6 months. We'll talk about a developing story. That's what we learned with the COVID vaccine, that you get full immunity when you get those 3 doses. And who should get the third dose? Well, certainly people who've gotten Johnson & Johnson, people who are in the sort of front line of whatever. If you are frontline doctors, nurses, healthcare, frontline because you're helping to take care of kids, you're on the bus system, you help to handle the trash, whatever it is that you're sanitation workers, you should think about just because of all of your exposures, and then talk to your doctor about whatever medical conditions may make you more susceptible. We know that people when they are older, and here I'm going to be careful because I'm not far from this age, above 65, we don't mount as good a robust an antibody response as our younger counterparts. And every vaccine, with time, the antibody response tends to go down. So let's say that you have to have an antibody response up here to be protected. Well, you get the vaccine, you get the second dose, and you're up here. But if you're older, it starts to fall over time. And look, oops, what happens is that it gets down here. So you need that third dose to get you back up here. All right. People ask me, what's the difference between Moderna and Pfizer? Think about it like Crest and Colgate. Same, toothpaste, very similar, just different brands. So stay tuned. Think about getting the third dose. If you haven't gotten vaccinated, think of all the children in your life. All right. So that's my my update about COVID. And I'm sorry, Dr. Turner, thank you for indulging us. But there is so much misinformation that I thought it would be important to update everybody. Well, without further ado, I'd like to bring on our special guest this evening, Dr. Robert Turner II, right?
That's correct.
Who is a faculty member and has really dedicated his professional life to learning about what happens, especially to the brains of athletes when they have been involved, especially football players, in high impact sports. And we thought actually Ms. Ashanti Carter, who's the program manager and who helps put on these arranges for these webinars, she's from the Rodham Institute, she timed it so that it would coincide with kids going back to school, our football season, etc. So full disclosures, I know this is surprising. I love football, both collegiate and the NFL. I'm a Michigan fan, and you see Michigan has been doing really well, although we haven't played, well, we've played some teams. We'll see how we do when we play some, well-placed teams. But Dr. Turner, welcome. We're so delighted that you're here. Can you kindly introduce yourself, name, rank, and serial number?
Sure. And let me first start off by saying, wonderful to have me here, and really great to be here. But second, no apologies needed for that introduction, that discussion about COVID, because it is just so important to have that information out. I'm going to record it and make sure that all my friends and family and everybody hears it, because I think it's vital, and we just need to make sure that our community hears it. So,
right, and actually, I will just add this, Dr. Turner. The Rodham Institute is part of the Black Coalition Against COVID. We're actually on the steering committee. So if people want to hear more information, please go to blackcoalitionagainstcovid.org. I also have a show on blackdoctor.org. Actually, it's right after this. It's at 8 o'clock every other week. But the blackdoctor.org has a lot of excellent information. And then one of the newest sort of members of that are doing great work is Dr. Cheryl Hargrove. She's got a program called Flip the Script. Sorry for that interruption. There's a lot of great information out there.
That's good, because I'll make sure that my lab and how we promote all of our research, and I'll make sure we get the appropriate links and send it out through social media, because that's just vital. I can't say enough how important that information is. So thank you very much. So back to your initial question. So I am an assistant professor and in the Department of Clinical Research and Leadership in the School of Medicine and Health Sciences here at the George Washington University.
Mm-hmm.
I first joined the faculty, I believe it was in January of 2018. Initially, prior to that, I was at Duke University. Well, let me just start off by saying that I received my PhD in medical sociology at the Graduate Center as part of City University in New York. And after that, I received a postdoc training in health science and medical science research at the medical school at UNC Chapel Hill. And then from there, and that gave me the opportunity to really incorporate into my work. I was trained as an ethnographer, and I did an ethnography. We'll talk a little bit more about my book, which is called Not for Long, The Life and the Career of NFL Athletes, which started off as my dissertation, but it didn't focus very much on health. And so I wanted to really kind of understand health disparities, some of the questions that had risen when I was doing my dissertation work. So I was very fortunate to have great mentorship by Dr. Tamara Corn Beasley while I was at UNC. And then after that, I completed the book with support at the University of Maryland at College Park, which is what brought me to the DC area. And then from there, I received additional training. I've been on faculty, research faculty at Duke University prior to coming here to George Washington University.
So if people want to get your book, where can they get it?
Well, I would say you can come to, I have a personal website, which is robertturnerphd.com, and all the information is there. You can purchase it directly there through Amazon. The book publisher is Oxford University Press, and so through my website, they provide a discount. I believe it's about 20% there. You can also find it on Amazon. I've been very, very fortunate. The book first came out in January of 2018, and well, actually, it came out during football season, right at the timing of the football season in January 2018. And if you remember, at that moment, that was when there was a lot of information going on, a lot of upheaval, I guess, around Colin Kaepernick from the former administration, former president. And then there was, he made comments about athletes, if they didn't want to stand, they should kick the SOBs out, and all of that came out. My book came out right at that time. And so I was fortunate to do a national tour, and it caught up a lot of media attention. And really, we have a chapter in the book about Black athletes in the NFL and what is that like? And I guess, that kind of at that right time with the president talking about it, and Kaepernick, really some of the issues that I brought to the forefront in the book prior to even the president discussing these issues.
So what got you interested in athletes? I mean, what was it? I mean, you mentioned that you're an ethnographer and that you had written this book. What was interesting too. You look like an athlete yourself, so.
Well, I will put it this way. I'm in the former athlete category. That was a
Mhm.
long, long time ago, but I do live vicariously through my nephew right now, Cole Turner. He plays for the Nevada Wolfpack at University of Nevada at Reno, and he's doing excellent and really just proud to see him, living his dream. But I was very fortunate. I'm from Piscataway, New Jersey, and my parents moved. We initially moved from Newark and for better opportunities, better schooling, and that kind of thing. And as a young kid, I just fell in love with football. I mean, I remember watching all the men in my family. They were huddled around on Sundays. We had big extended family, grandparents, and everybody around it. And I
Mhm.
just remember, before I even knew what I was even talking about, I just remember everybody screaming at the TV, and I just looked at them, and I looked at the television, and I said, I don't know what that is, but whatever it is, if it gets people that excited, that's what I want to do. And so so I started playing football about 9, 10 years old, flag football. My dad was the coach. And then I played Pop Warner and then graduated to high school. And my dream was always to be able to play in the NFL. And I knew that, the way to get to the NFL is you had to go to college. And so that was my primary motivation for college. I may not have ever gone if it wasn't for that. But I was very fortunate that I decided to play football at James Madison University down in Harrisonburg, Virginia.
Mhm.
Play for a great coach, Coach McMillan, Chalice Joe McMillan. And he did something that was, really important when he recruited us. And we were acting up as freshmen, me probably coming from the city down to the country. And at JMU, he pulled me in the office one day and he said, you're not going to make you're not going to make me a liar, are you? And I said, why? What are you talking about? He goes, well, don't you remember when I bought you here? I offered you a scholarship. You sat in that chair. Your parents were in those chairs. And I made a promise to your parents that you are going to graduate. And so you need to straighten up, understand what's required of you to be on this football team. It's a privilege. And so therefore you need to live up to that responsibility. And so
Mm.
he's really set the tone for myself and all the other guys that went to school together. Lots of us wound up playing in the NFL. I played in the Canadian Football League, the USFL, and very briefly in the NFL. But that was the beginning of my journey. But for me personally, something happened at the very end when I finally I got released by the San Francisco 49ers. And and I write about this in the book, but the general manager asked me a question, and I realized the question that he was asking me devastated me because it wasn't the one that it was the question behind the question. But at the end, he said, thank you, we appreciate you being on the team, but essentially your services are no longer required. And the question he asked, he said, where do you want to go? And at that point, at 28 years old, having had played 4 years of professional football I knew that it was time for me to leave. I knew that my end had been done. I had started playing at 9 years old. And when he said, where do you want to go? I absolutely had no answer to the question.
Mm.
He was basically saying, we'll buy you a plane ticket. You can go back to wherever you want to go. And I didn't want to go anywhere because all I ever wanted to do was be right there on the team. And so when he said that, that was my existential crisis. That was the crisis that I did not know where to go. And it took me from that point in time until I started graduate school at 40 years old. I call those my wilderness years because I really wasn't prepared for my transition to life after football. And
Mm.
essentially that book is about, all of the issues that athletes deal with. And by extension, anyone who's committed their lives to a role, to an identity, and then you have that ripped away from you. And then you ask yourself, where do I go from there?
Wow, there's so much for me to ask you about there. First, what was your position? What position did you play?
I was fortunate. I started in college my first 2 years as a wide receiver. And I will
Mm-hmm.
say for those people who are in the Washington area, you're probably very familiar with Gary Clark, won the Super
Mm-hmm.
Bowls. Clark and I went to school together for 4 years, and he was on one side of the ball and I was on the other side. And we were a tandem that played receiver for a couple of years. And
Wow.
then I moved on to defensive back, and I played my last 2 years there. And so fortunately, when I went to first the USFL and then the Canadian Football League, I started as a defensive back. And then I had the opportunity to play a couple of games in my old position as a wide receiver up for the Calgary Stampeders. And then I transitioned down to the NFL and was briefly with the 49ers and played strong safety there.
And Coach McMillan sounds like a wonderful human being who cared about you and the rest of your teammates as young men, really, because not all coaches are like that. I mean, I went to Michigan during the time of Bo Schembechler, and that's not how the football players were treated. They were treated like gladiators, but once they were done, they didn't, people didn't really care if they graduated. I know that that has changed, but nevertheless, that is a blessing that you had somebody like Coach McMillan to kind of shepherd you along and play that mentor that really understood who you were and what motivated you. And I love the fact that you mentioned that you wanted to go to school to college because of football. But that's what Ms. Cora Berry does with the Southeast Tennis and Learning Center. She uses tennis as the hook to engage people in education. So whatever way, and of course that you got there is so important. And I just am reflecting, you said existential crisis at the age of 28. A lot of times people are older when they go through that. That's why it's called the midlife crisis, right? But for you, I just want to talk about this sort of person. I mean, you said those wilderness years, you've made me really curious to read your book now and find out more. But was there a moment during that time that you said, this is what I'm going to do, or an epiphany, or was it a gradual process that kind of got you to graduate school? Please talk more about that, because as we really, one of the things that Rodham one of our priority areas is actually to get more Black and Brown folks into positions in academia, in leadership, as you are. And especially as a Black man, it's so important to hear your story.
Well, yeah. Well, so I'm gonna address that by backing up a step, because I think, and I write about this in the book, but I've interviewed, one of the things about the book as an ethnography, the anthropological kind of position where you go and you live with people and you really understand how they make meaning and how they experience the world. What was really kind of, for me, I had lived this world, but then I also had to try to figure out what changed, what is similar to what I experienced and what is different, because things change over time. But the couple of things that I think are very, very important, especially when we think about our young Black men and we think about supporting them and providing opportunities for them. And Dr. Harry Edwards, who was at the University of California, Berkeley, and he's known as the father of American sports sociology. And so he talks about, the overemphasis of sports within the Black community to the detriment of many Black athletes, both women but particularly for men. And so there's one thing that happened to me that helped me shape and kind of understand, looking back at my life. But there was a coach when I was a freshman in high school, and he said to me, he looked at me and he said, he said, you work so hard, and if you continue to work like this for the next 4 years, it will be a pleasure to say that I have coached you. And that type of public affirmation, the status that gave me in front of my peers, it made me want to work. I wanted to hear that type of, support every day. It almost, in a crazy way, I almost was disappointed that he didn't say it more often, because I wanted it so bad, which is really kind of funny, because I grew up in a household with a mom and a dad, uncles, and we had lots of men around, and I had great support, and I had a very good sense of who I am and supporting my family. But it was just something about the coach that had said that, when he said it in front of my family, and my peers, I really crave that kind of talk or that kind of accolades ever since that point. And I think that that's a very big motivator, right? Because if you think about young Black men, particularly those, unfortunately, that may not have those male figures around, and you get that one person that stands up and says, you matter, you are someone that we care about you. I learned at that point that you can take a young man like that, whether it's a coach and a positive, or whether it's a gang member or anybody, but if you can support a kid like that, that young man will do anything for you. And I was prepared to run through brick walls for that, right? And fortunately, you know, I had the other sports and a lot of coaches and all this positive affirmation and people looking after my life. But what happens when there aren't those positive influences? And so I think that that's very important. The other thing that happened to me during my time, and I think you can relate to this, we had moved during a time where, you know, I was that first generation of students that went through, you know, when schools were really desegregated and they made, you know, that they started doing busing. And so therefore we were integrated, the whole integration system, you know, not way back in the 60s, but I mean, the 50s, but during the 70s, that was when people started moving, Black people started moving to the suburbs and all this other stuff. And there was a lot of discomfort. There was a lot of racial tensions in the school. And what was very clear to me was that people loved me when I excelled in sports, but they didn't have that same expectation for me in the classroom, right? And so therefore, for me personally, growing up in a predominantly white community, coming from a predominantly Black community to one that was predominantly white, they didn't put those expectations on me. And so therefore, I started to see myself as more of an athlete than in education. And education was not something that I pushed really hard for. And I see that whenever I give talks at schools now, especially, and I speak to teachers, I think I really emphasize how important it is for us to have those high expectations for young Black men in all areas of their life, not just on the athletic field, and show them that they can do a lot more, right? So I say that to say to you, my grandmother, what really led me to realize that education meant something was when I graduated from college. And truthfully, I was a C average student in college because I really was there to play football. I did what I did, but I didn't really excel the way I probably should have. But my grandmother, I had never known this. My grandmother she migrated from North Carolina, moved up to New Jersey to give her family a better life. And she moved early in the Great Migration in 1920. And she was in her 80s when I graduated, and she came to my graduation and she gave me a crisp, brand new $100 bill. And she said, I've been waiting my whole life for one of my children or one of my grandchildren to graduate from college. And so, I think at that time, my grandmother didn't have but a 4th grade education and my grandfather maybe a 5th grade education. But that made me realize that I didn't know what I was going to do, when I was going to go back to school, but I knew I had to go back to college. And so it was just fortunate for me to go back and choose what I did. And I didn't go back until I was 40 years old. But it was the motivation of my grandmother gave me that made me say, you've got to go back to school. And so that was my journey, really going back and getting a PhD, starting at age 40 and working full time and going to school full time.
Wow, what an inspiring personal story. And you reminded me of 2 gentlemen that we had invited to one of our earlier summits at the Rodham Institute, Dr. Kirkland Vons and Dr. Warren Spielberg. They did a 2-volume book called The Psychology of Black Boys. And they used the word boys deliberately because so many people call boys men, and the average age that kids are seen as being is 4 years older than they actually are. So we see this, of course, when there's coverage on the news, so I like to make sure that I call a 9-year-old boy a 9-year-old boy, so it's very interesting. So thank you for that. So tell me about your particular research that you do. Please enlighten us on that particular area and what you've learned and what you've been doing.
Sure. So I'll start, again from the book. When I was doing my research initially, I was really not doing health related research whatsoever. It was just 2 things that happened during the time I was in the field that made me say, okay, I need to start better understanding this. One was I was interviewing an athlete, and he said to me, through our conversations, I said to him, wow, you were doing all these things in your life seems like you're really self-sabotaging your career. Kind of Philip Bobo, who played for the Raiders for a couple of years, Rams, that kind of thing. And he said to me, Robert, I think now that you mention it, he goes, I was depressed. And I said, wow. I said, you self-sabotage your career because you were depressed. And he said, yeah, I was this young man, and I was hurting inside from so many different things that had happened in my life, and I didn't know how to ask for help. And so I did all of these crazy things. And other people, when I was in college, they just excused it. When I was playing ball in the pros, they excused it because I was such a good athlete. But no one cared to take the moment to look at me and say, wow, what's going on with you in your life? Right. And then that's one of those things, going back before, we were talking about with Black boys, Black men, we're always seem to be, the supermen. You can just carry through anything else. But we're starting to hear people say now that, yeah, it is okay to ask for help, but it's always goes back to this: how does the hero ask for help? And then there was another athlete that I interviewed, and he made a statement and said, while I was playing ball, and this was a Stanford grad, had 14-year career, and he said, while I was playing, I was going through a divorce, and I had 3 kids at home. And he said it was really mentally and emotionally tough. He said, but the one thing I couldn't do was go to my coach and say, Coach, I need a mental health day to go take care of things. He said, I just had to figure out how to tough it up. And then, so those were a couple of things. And then another point that happened is one of the athletes that I had, observed, witnessed, and interviewed, he committed suicide while playing in the NFL.
Oh, no.
And so these started the questions of what is going on. And I knew that I wasn't good enough to, if I was dealing with depression while I was playing, I would have just not been able to continue to play. But I thought, wow, how do these things happen? How does the brain work? How do these men work going through all of this stuff? And so I really wanted to understand, and that's the work that I'm doing now, is I'm trying to understand. My work looks at, and I have a study, a KO1 award, but my work I look at kind of multiple factors involved with neurocognitive and psychosocial factors as they relate to, sports injuries, concussions, and accelerated cognitive decline, and potentially leading to Alzheimer's disease. And
Can you say that in plain English?
Yeah, I can. So basically, I want to understand basically for 2 things when it comes to men that play football. How do the things like, the way that their identity, their social identity, their personal identity, their masculinity, and the way that they even look at injury and look at their health behavior, how do those serve either to protect their brain health or put them at greater risk for their brain health? So when we think about men in general, all men, but in particular, we start to think about Black men. I would come from a lineage of men in my family. They would just never go to the doctor. They wouldn't go to the doctor until, their doctor was the emergency room. Well, then we know that puts them at a great deal of risk for all kinds of diseases, all kinds of problems, because you're not proactive, you're reactive, right? And so that really puts you in a bad position. So I want to know, are we as Black men, there's really important research that it said Black people actually, they believe that when questioned in research, do you believe that a mental health professional can help you if you have a mental health problem? And they affirm that belief higher than whites. But then when they ask them, do you go to mental health professionals, we actually go less than whites. So those are the kinds of things I'm trying to understand. What does impact our health behavior and our health beliefs, and how do we intervene on that in a way that it may protect our brain health?
Well, let me tell you, certainly the Rodham Institute, taking the lead from our communities in Ward 7 and 8. When we first started, we commissioned an environmental scan that was done by Ms. Khadija Tribble, who at the time was a community health worker. Now she is a health advocate in a different space. And she did deep interviews of residents of Ward 7 and 8, and their health priority, number 1, was mental health. And so our last summit was actually reducing the stigma of mental illness, right? But I think that one of the things that COVID people have not really recognized, and we're really trying to promote this, is that people's mental health has taken a huge hit, particularly people from Black and Brown communities, for all the reasons that we know. Not only did we have the pandemic, not only did we have the previous administration's constant barrage of insults, right? Constant, racist, fill in every other kind of thing, racist, sexist, homophobic, anti-Semitic, the list goes on and on. But we also had the serial murders of Black people.
Absolutely.
And when I see a patient, I always ask every patient, how's your family doing? How has COVID impacted your family? And invariably, African Americans will cite having had some profound impact because of COVID. And the mental health piece, whether it's parents that have to educate their kids with, in virtual learning environments, or having the responsibilities of multi-generational households, or there's so many things that one can add. Mental health has taken, a big hit, and to access mental health services, I would say that COVID did allow the telehealth, which is good, but we still don't have that covered adequately by our health systems, right? If you wanted to go and you were having chest pain, you could go to the emergency department, get admitted, have a stent placed for $20,000, $30,000, no questions asked. But to your point, to the mental health piece, that can be elusive. But I do want to promote. Taraji Henson has the Boris Henson Foundation. And through the foundation, their foundation is dedicated to educating, but also making sure that people have access, the African Americans have access to mental health services. So I actually sit on their tribal council, their advisory board, one of their advisory boards. And Rodham has incorporated them to allow for some of the people that we work with to have these services that are just so important. So thank you for bringing that up, because your mental health, one's mental health, impacts one's health behavior. And I'm going to put myself out there. 15 years ago, I had breast cancer. I had missed 2 or 3 years of mammography because I was I eventually got divorced, but that's how it impacted me. I was last on my own list, and that's what was the consequence. So I think that's so important. You've brought up just a tremendous number of such important points and issues. So what have you, sort of in your research, what are sort of the main highlights of what you found?
Well, yeah, I want to, again, just to add a little bit more to what you were saying in terms of, I'm really trying to build this area of research out in a way that for our community that, there are people who are all starting to move, and we're working in unison together. And so when we talk about, it's one thing to recognize that you need help with mental health issues, and we're raising that up and we're trying to destigmatize that. But I think another area that we have to really focus on is what are the barriers that may be in place that may prevent you from actually being able to take care of your mental health or reach out for the resources that may or may not be in your community. Again, stigma is one of those barriers, but at the same time, as you had mentioned, when you are going through, when you're going through a divorce and you're trying to keep your head above water, or you're just trying to understand how, your life is so stressed, how do you start to be able to remove some of the stress and the anxiety to then be able to go forward and do those things? How do you find out what resources are available? I work with, and my work is rooted in this area. Really, everything that I do is driven through this concept, community-based participatory research. And even though I work with NFL athletes and college athletes, I also do some work around caregiving, Black male caregiving here in Washington, D.C. And I work with Terrific Inc. and several of the other community-based organizations here. I still take that same approach when I work with former NFL athletes by working with the NFL Alumni Association, or recognizing that the way that I really am able to interact and engage with the athletes is because I'm part of the community as well. I'm not doing the research from outside the community. I'm doing the research inside the community, because whatever we learn is going to directly impact me as well. So I spend a lot of time trying to hear and speak with people doing, kind of very interdisciplinary, mixed methods, multi-methods work, where we take what we learned from doing the interviews and the ethnographies and the focus groups, and we should then try to apply those to the surveys that we get about their overall health, and then to better understand what are the implications of people's behavior and how do we then intervene on that behavior. And so a big part of what you were just talking about in terms of mental health is really trying to understand what are the barriers that just on an everyday, day-to-day life, people trying to get to work, having issues, or like you say, trying to raise a family at the same time as you're educating them, at the same time you're trying to keep your job, all of those stressors. What can we do, and what can we learn about how people see those and interact with those? How can we support them so that way they can reach out and have more positive mental health?
Wow, you mentioned the community-based participatory research, which I really want to come back to, because one of the successes that I believe of the Black Coalition Against COVID was, and if you go to the website, you can see that the 4 historically Black medical schools are part of that. And also to point out that the researchers, whether they be the scientists, like Dr. Corbett, who was involved in actually developing the Moderna vaccine, or other leaders, on several levels, researchers, clinicians, et cetera, that research is not a dirty word. It is the issue, though, is who is the research being done by, for whose benefit, and is this part of a larger structure that really puts the community in the driver's seat and not just as subjects? So can you just describe what community-based participatory research is for our audience? Because there is such a stigma when we hear about research, but the reality is research is important, because that informs our knowledge and potentially our ability to help and heal different communities, right?
Sure, absolutely. So I'll start from this perspective. What really opened my eyes to this, I was at the University of Maryland, their School of Public Health, and we had some high school students there. There were Black men I brought them from my high school in New Jersey. And one of the professors there said, how many of you here know anything about public health or want to go work in public health? And of course, very few of them did. Some of them wanted to be doctors. And they said, we're right up the street from the National Institute of Health. And that is the place that people there make decisions about health policy that are going to impact your health. And would you be surprised to realize that there are very, very few people who look like you are sitting in the room making those decisions about your health? Right. And so that really struck me as how important that was. And I realized that, we need to get young people out that are in the communities, and they know what's going on best in their communities. And so for me, community-based participatory research is even a little bit farther, downfield than what maybe some other people think. I think the way I approach it, the way I look at it is, I think that people in the community, they know the questions best to ask from their community. They know what's going on. And so what we try to do is build relationships with them. We don't try to take away from them, but we try to say, okay, if we can work together, you can help educate us as educators and as researchers, and we can help educate you from the priorities that are from NIH. We can figure out together how to develop questions that are important and pertinent to our communities together. And then we can design that research together, and then we can use everyone's expertise, come together to gain the information that we need to be able to then apply the, the scientific rigor and and methods that are necessary to be able to inform medical doctors, clinicians, other researchers, as well as policy makers. Because ultimately what has happened, and we've seen this happen in some universities, is they say, oh, here's what's important to us,
Exactly.
or here's what's important to them at NIH. And so we'll give us some money, we'll go out to the community and we'll get that information for you. Well, I think that is, replicating all of the disparities that we've seen in our communities. And it's time to make that change and to stop from that. But the way we do that is you have to have both people from the community as well as academics and researchers and medical doctors. All of those people are also engaged from those communities as well, and are committed to be there for the long period of time to do the type of research that's necessary. So that's how I look at it.
Yeah, no, for sure. And I think I actually wrote an op-ed in the Washington Post where it's talking about shifting the locus of power to the communities, because it is really about increasing the socioeconomic educational capital of the communities so that people are in charge of their self-determination and autonomy. And to your point, the people that are closest to the problem know the solutions. They may not have the resources, right? And actually, we got a very small, very tiny grant through the American Board of Internal Medicine with my good friend and colleague, Dr. Marie Borum, who's the Division Director of Gastroenterology, in partnership with the Pennsylvania Avenue Baptist Church, where the congregants are going to be involved in teaching our learners what are the best ways to talk about colon cancer screening. What are the,
Absolutely.
right? So, because clearly we're not doing a good job. So just saying, okay, we're going to go in and point our fingers and, you need to do that. That's not working, right? But thank you for explaining that, because
on that point, I need to take this time just real quickly because I think your audience is the right audience for this. So I was very, very fortunate. I'm the principal investigator on an R13 grant, conference grant, that funds us to be able to have a Black men's brain health risk and resilience conference for the next 3 years during the Super Bowl week. And we're starting in February 8th through the 11th, and and in that program, we're funded by the Alzheimer's Association, the National Institute of Aging. We have a partnership with the NFL Alumni Association. But a key part of this whole thing is we have an emerging scholars program where we are recruiting for the first cohort, we're recruiting 15 scholars who want to learn how to conduct community-based participatory research around Black men's brain health. And so with that, we are the scholars, to be eligible for the project, you can be a clinician or a researcher. You can be in graduate school pursuing a terminal graduate degree. You can be a postdoc, or you can be an assistant professor, early career. And we even have slots that are available for associate level professors. And the whole issue is these are people who want to be trained by experts, and we have our training program is for the next 18 months when you get involved, and you'll go to 2 Super Bowl conferences. This first one will be in Los Angeles, and then the next one will be in Arizona. And so we're taking applications now. We really would love anyone who wants to learn how to do this work, and really culturally appropriate work within this area. And within the program, we also have, we are building a Black men's brain registry where we're recruiting men who agree to be part of participants in the research studies that we're doing. And so you can go to my website, you can go to the several website. We have a flyer that we can give you that you can distribute to people, but we're really aggressively looking for to build cohorts of young people to get involved with this research to help us be in the communities.
Well, that sounds terrific. And I know that Ms. Ashanti is posting some of those links right now, but we please share that with the Rodham Institute so that we can push that. I actually am thinking of one of our former Rodham Institute interns, his young man that went to Gonzaga. He plays football and now is at Johns Hopkins University. And this is an area that he's very interested in, Loic. So I can think of him right
Please,
off.
please. And let me just say, we are not only limiting our scholars program to men. We have women that can be involved with it, from different nationalities, race, but people who are committed to doing this work and understanding Black men's brain health issues.
Wonderful. So please take us back in history, because the research that started on football players and sort of brain injury was first done by an African-American researcher, or at least he was of African descent, not from the African diaspora. Can you tell us a little bit about that story?
Sure, Dr. Amalu. And it's interesting because if you go back into the literature, the very first article started back in the turn of the century. There was an article, it was really all where we got this this term punch drunk from, pugilistic, I think they called it disease. And that was really where boxers, and remember back in those days, they were knuckle fighting
bare knuckle.
A bare knuckle, right? And so the first article was back in about 1919, and then there was another article in maybe 1937, but and that had really recognized this, and it was not where we call it today CTE or dementia or anything, but they did notice some of the pathology there where people slow speech, forgetfulness, and that kind of thing. But then Dr. Amalu, about, I guess, around 2012, 2013, somewhere around there, or maybe just a little bit before there, he stumbled upon the case of Mike Webster, who was the center for the Pittsburgh Steelers, and he recognized that he had these issues, these memory issues, these also behavioral issues, and that kind of thing, and recognized that in several different athletes as well. But of course, that's where he came up, where CTE really started to get a lot of attention in the media. But of course, CTE cannot be diagnosed while someone is alive. You can only see it post-mortem. And so that's where we really started to be in the forefront of the media at around that time. And since then, it was very slow. It gained a lot of attention in the media, but it's very slow in terms of gaining attention in the scientific world. But then just recently, I would say within about the last 10 years, there's really just been a big push on this. And I'm very, very fortunate that I am one of the investigators involved with the Diagnose CTE project out of Boston University that's led by Dr. Bob Stern. And so I was just appointed as the director for the diversity, equity, and inclusion, and looking at racial differences as the outcomes, the difference between Blacks and whites in there, and what can we learn as to, the different pathologies by race.
Wow. So we've got a local expert at GW in our GW community who's nationally recognized and is on the forefront of leadership and research. That's terrific. So we've got about 7 minutes left, and I encourage anybody who's got any questions to please put them in the chat. But I have a sort of a practical question. When my brother, who was a huge Pittsburgh Steelers fan, and I remember when we were growing up, he's my baby brother, had Franco Harris, a poster on his bed. He had his little, helmets that he painted and all this kind of stuff, wanted to play football. Now, mind you, this is back in the 70s as a child. My parents said no, because they were actually worried about head injuries. What is okay to do? Okay, because football is, it's a fun sport. It's you get out there, you run, and all those things. There's certainly strategic thinking, when you're out there and making plays, and I can see I personally can see the value. I don't know about the head trauma and all that, but how can a child, a boy or a girl, because my sister wanted to be a kicker, but she was told no back then. How do we protect, our children who are wanting to play football from future harm?
Sure. I think this is a great question. And people ask, if you had a son, would you let your son play? I don't have children, but obviously I'm very supportive of my nephew playing and things like that. But I think there's several things that are important that really transcend football. I would say this about anything, but it is particular to football as well. One, make sure you know who's coaching your kids. I think that's really important. Are the people that are coaching your kids, are they just ex-football players that say, I really understand football, or do they understand how to make sure that your children are safe? Do they know how to tackle properly? Do they make sure that they limit the amount of time that kids are actually hitting one another, right? Those are the things that really, when we talk about concussions, Dr. Stern, who says, hey, listen, I don't really know much about concussions, but what I'm really concerned with are the repetitive head impacts. So how much exposure to head trauma are your kids getting? Like the repetitive head impacts? And so, I'm starting to he's winning me over into believing that in terms of just the exposure to the head impacts, I think it's fine to hold a child out from playing tackle football until they're in high school. It gives them the time. 14 years old, I think it would be fine. I have no problem with a child, again, playing a little bit younger than that. But if you're really, really concerned, I would say it's fine to wait until they're in high school. But if they're playing even younger than that, make sure that, again, that they're learning how to tackle properly. Make sure that you're an engaged parent, that all the right protocols are in place to protect your child's health. And it's whether it's a broken bone or it's an injury to the head. Make sure you know who's there. Make sure you're engaged. Make sure that the child knows that, one of the biggest issues is kids don't want to come out of games. They don't want to tell you that they're hurt. They won't tell you something's going on. And you have to build that relationship with them, that if they are, it's okay. It doesn't mean you're less than a man, less than a girl. It doesn't mean that you just do it, suck it up. It means that we're going to take the proper precautions to protect your health. And that's one of the biggest things that I think is important, is to educate your child, make sure who's there, training them, and then be engaged, right? And if you see something your child is not, they may be a little bit off or something like that, make sure that you get your child taken care of and looked at, instead of just relying on what the coach tells you what's going on with your child.
I think it also comes back to this idea of what your identity is. If your child is only being sort of fostered in one area, right, instead of being looked at as a scholar athlete, where education is also important, having a diversity of sort of interests and talents, that's another thing, right? Because if all you're excelling in or being pushed and promoted is a sport, and hey, look, you're also very smart, you're also great in math, or you're also a great artist, or whatever it is, I think that comes down to it. But thank you about that point of coaching. You should really be attentive to who's spending time with your children, period, whether that's their friends, because that obviously impacts them. But I think that, the point you made, which is definitely true in football culture, and actually it used to be very true in medical culture, is this idea of suck it up, shake it off. I don't want to hear you complain. And one of the things that I think has been positive with Naomi Osaka and so forth, saying, look, I got to take a time out. I'm not okay in terms of my, mental health, or whatever it is that they're talking about. Well, listen, we've got just one more minute left. Any closing remarks? I could talk to you for several hours. I think that this has been such a rich and robust conversation, but any final points that you wanted to make for our listening audience?
Well, someone did ask, and was there a website? So we have the website, mensbrainhealth.org, where the application is for the Emerging Scholars Program. That's number one. Number two, I think, again, there's just so many different things, but I will close with just saying, in terms of, going back to the adage, it definitely takes a village. We care about, for me, I do work on Black men's brain health, right? And I do it over the life course. So I look at the young ages, but all the way up to, I do a Black male caregiver study, and I look at stress, physiological and neurocognitive stress with them. And so all I would just want to encourage people to say, you know, we need you to be involved in research. We need to really support young people in their visions and their goals and their dreams. I would say, you know, when I was young, I really wanted to play football. I was able to live that dream. But people also told me that I was so much more than a football player. And the one thing that I recognized, that when I had my crisis at 28 years old, I did say to myself, if the highest pinnacle of success, I've already experienced it at 28, then I'm in trouble, because I got a whole lot more life to live. And so fortunately, I have family and friends that just instilled into me, keep dreaming, keep aspiring, keep pushing on. And I really just want to encourage us to support young people to live their dreams out too.
What a lovely way to close. Dr. Robert Turner II, Assistant Professor at the GW University. Thank you so much for this inspiring, rich conversation. And I want to invite you to blackdoctor.org, my show, so that we can have you there, because you have very powerful message. And we will make sure to push out all of the wonderful resources that you have mentioned on this webinar. And I just, before we say goodbye and good night, I want to say thank you to Ms. Ashanti Carter, Program Manager at the Rodham Institute. All right, everybody, good night, stay safe, take care, and we're